Welcome to Park Avenue Plastic Surgery Class, the podcast where we explore controversies and breaking issues in plastic surgery. I'm your co-host, Doreen Wu, a clinical assistant at Bass Plastic Surgery in New York City. I'm excited to be here with Dr. Lawrence Bass, Park Avenue plastic surgeon, educator, and technology innovator. The title of today's episode is Small Treatments, Big Results. Dr. Bass, tell me about the idea behind this episode.
Really, I was thinking of two things here. First, most treatments are either small treatment, small result, or big treatment or big surgery with a big result. But there are some exceptions. These are treatments that don't involve a big investment in recovery time or money, but have a significant impact on appearance. Second, treatments that address small features that are often overlooked, but provide obvious telltales of age or other unwanted features. I'm going to discuss some examples of these things with our guest today. Dr. Munique Maia was a plastic surgery resident at the Northwell Health Program with me, and then completed the aesthetic surgery fellowship at Harvard, and is now a plastic surgeon in the Washington, D.C. metro area with a very busy and popular practice. Dr. Maia, welcome.
Thank you. I'm so excited to be here.
Okay, let's get started. So, Dr. Bass, let's revisit the first point you brought up, small treatments that have big results. Can you detail some examples for me?
So probably the best example is Botox and other neuromodulators, things like Dysport, Xeomin, Jeuveau, and now Daxxify. Often the area that's being treated is something small, like the 11s, the little vertical lines in between our eyebrows. It seems like such a trivial, small thing, but it has such a big impact on our appearance. The impact is so big that it's the most popular aesthetic treatment of all time. Even though it's just a few little lines, that's how it started. Now, of course, we use it for many other things as well. IPL or BBL, intense pulse light, broadband light. This is a light-based energy treatment that will knock back redness on our face and clear off a lot of the irregular pigment, the brown age spots, and give us a fresher appearance. And that treatment that typically has no recovery and is done in 2 or 3 treatments can really, really change how old and worn out you look if your skin has a lot of those features and then becomes clearer, fresher skin. So that's another great example in my view. Things like microdermabrasion, not invasive treatment, no recovery, but it really freshens the skin. I think of it like the dental cleaning of the skin. Everyone's skin is better off with a little microdermabrasion. And things we do around the eyes, that periocular area, the area around our eyes, is a small area on the face, but it's the area where everyone is looking most of the time. So doing a peel in that area or a little filler in that area or even having a blepharoplasty, which is a surgery, has a big impact on your appearance, even though it's a small area, because if you freshen that area, that's where everyone looks when they talk to you. And of course, there are a lot of filler options, and Dr. Maia and I can talk about this a bit, where we hit small features on the face that have a big impact.
Dr. Maia, what are some examples that you see in your practice of this?
Yeah, so Dr. Bass mentioned a few popular procedures that the plastic surgeons perform with minimal to no downtime and a huge impact on the patient's appearance. So one of the things that he mentioned was fillers. We can do a lot to volumize the face, to reshape the nose, or even make the jawline more defined. It's a very popular procedure to use fillers to rejuvenate the face and also to reshape the face. So liquid rhinoplasty, so we call non-surgical rhinoplasty, can make a huge impact on patients that are not ready for surgical rhinoplasty. It's also small procedures like Dr. Bass mentioned is you can do fat grafting to the face, so even an upper blepharoplasty that can make a huge impact on someone's appearance with very minimal downtime.
Yeah, and I think that's important. I mean, everyone's got a busy schedule and everyone has to budget a little bit, both their time and their money. And so being practical about what things can get you a really improved appearance quickly is something to spend a little time thinking about. That's something to include in your planning.
Let's talk about the small features that shouldn't be overlooked. What are you referring to here, Dr. Bass?
So I'll give you a couple of examples. We do filler, would build cheeks and straighten the jawline and, big changes, but putting a little filler in an aging, empty earlobe and making it look like a plump, youthful earlobe really improves aging appearance and creates an attractive feature instead of a worn out looking feature. And the same kind of thing when you're doing laser for wrinkles. A lot of people will laser their upper lip or laser the face, but they leave out the earlobes, and you have a wrinkly earlobe with a smooth face, and that doesn't look right. And you can have a nice smooth earlobe, and if you're already having the recovery time of lasering the face, why wouldn't you include the earlobe? The same is true with the nose. The nose always has large pores. We can't get rid of pores because they're a normal part of the skin, but we'd like to make the pores smaller, smooth out that skin a little bit. And so if you're lasering a large part of the face, always a good idea to include the nose. Another area to think about is the neck. And, if there's hanging skin, sort of that turkey gobbler neck, we always see that as a bad feature. But there are a lot of other aging changes in the neck that show up even earlier that make it very clear that you're no longer a young adult. So crepiness in that skin, which is much thinner than our face skin, and some of the wrinkles that go across the neck, sort of creases in the skin in the lower part of the neck, are things that we can chase with a variety of treatments and give a much fresher look. Same idea with the décolleté, taking that area below the neck at the top of the chest that often shows even when we're dressed. You're wearing an evening gown or you're wearing a blouse at work, and that area shows. Blending the pigment and texture in that area avoids a mismatch with the rest of your appearance. And in the same thought process, having all the areas match up, chasing the appearance of veins and tendons and age spots and just crepey thinning skin in hands as we age, again, is a small area that a lot of people overlook or don't bother with, but that is often a giveaway of how much aging has really taken place, even though you've kept your face up. Another area that I do not very often, but on occasion that can be very pleasing is to boost the outer part of the brow, get a nice arching in the brow using a little bit of filler, which is placed right over the bony orbital rim. So it's placed fairly deep, but it just creates a little more of a shelf or support to hold that brow up. And especially for patients who aren't getting the brow lift that they would like to with Botox, this can sometimes be a way just to enhance that feature in a quick, non-invasive way. We talked about the eyes, and the tear trough area in the eyes is sort of a big deal. It doesn't have to be zero. People in their 20s have some shape there. But when you start to get a really deep trough that demarcates, the eyelid skin above from the cheek skin below, filling that in with a little bit of filler just has a dramatic effect on making you look rested, natural, but much younger than when you have a deep trough there. Another occasional filler area for me is at the nasal base, down by the side of the nostrils. Bone sinks in as we age, and occasionally, separate from just filling the nasolabial fold, projecting that area can help with the width of the nose in the area, the length of the lip in the area, bringing back a little more of the anatomy at the deep level that you had when you were younger. A filler area that I do frequently is temples. When temples look very hollow, that's an aged look. If you look at people at the far extreme of age, temples become very deep, and so that's not a healthy look. We don't want to be convex, but if the temple is too concave, it needs a little filler to level it. And Dr. Maia already mentioned the nose, and I think she is 100% correct. There's precision with fillers that we're never able to achieve with rhinoplasty surgery. And so if the feature is very tiny, we can more predictably create the shape change with filler very often than we can with surgery. If it's more of a support issue or a big shape change in the nose, that's more appropriate for rhinoplasty surgery. But there are many, many things we can do to change how the dorsum or the bridge of the nose looks, or the tip of the nose using fillers.
Dr. Maia, you probably have a list of small features you see as important as well. Can you share those with us, please?
Yeah, so Dr. Baz mentioned a few areas that are common concerns for a lot of patients. One thing that it's huge also in any plastic surgery office is skincare. So very important for patients to start using medical grade skincare. All the things that we do in plastic surgery, we want the skin to stay healthy. So skin, sun protection and good skincare will go a long way to maintain the results of office procedures. Lasers, energy devices also. We have microneedling radio frequency devices like Morpheus that can improve the texture of the skin, can help with acne scars, and also a little bit of skin tightening for patients that are young and not ready for a facelift, for example. So I offer this to my patients and I've seen amazing results. One thing, we always focus on the face, but there are new technology that helps also with body shaping, like M-Sculpt. It's a new technology that has high-intensity electromagnetic therapy that can help form the muscles and that proven to work well for a lot of patients. So these are things that are in a lot of plastic surgery offices that can help patients improve their appearance and feel their best.
Dr. Bass, you mentioned new superficial fillers a number of times. Can you and Dr. Maia each share your approach to addressing fine lines in the skin?
Sure. There are several approaches. I mean, historically, fine lines and wrinkles have mostly been treated with peeling, whether that's a chemical peel, a laser peel, or some of the fractional lasers and energy-based devices like Dr. Maia mentioned, RF microneedling. So these are ways to resurface the skin get a rebuilding of the superficial layers of the connective tissue of the skin, the dermis, and diminish the appearance or ideally eliminate the appearance of the wrinkle. And that's the classic way, but it's typically multiple treatments or recovery-based treatments. And so some of the new superficial fillers, and the first example in the US was Redensity or RHA1, but some of these fillers, and there are a couple of others coming online now, have the ability in a no recovery treatment to fill in some of the wrinkling superficially and structure that superficial portion of the skin. But you have the difference between a more durable correction of the skin and a plumping of the skin with the filler, which will absorb and need to be repeated in a few months. How do you approach it, and how do you decide, Dr. Maia, which patients should go
That's
where? How do you explain
interesting
it to folks?
question. It's always the art of consultation that we go what the patient wants, how quick they want to achieve that goal, and how much downtime. So I usually take a comprehensive analysis when I look at an aging face. And just like you, I like to combine multiple treatments. There's surgery is not the answer for everything. That's why we offer all these non-invasive treatments and minimally invasive treatments to help to either prevent or reverse the signs of aging. So usually the treatment plan involves a multiple modality treatments with skincare, filler, lasers, and sometimes surgery.
Yeah, and I think that's a great point, because when you push a little bit with multiple modalities, you stay at the low end of any risk profile, but you get a more complete correction because each one is contributing something that the other one can't do quite as well. When you try to take one modality and push it really hard, I think more likely to have some unpredictable result, and it becomes diminishing returns after a while.
Yeah, I think that's the synergy of all these treatments to help the patient achieve the goals. And as you said, the safe way, in a safe way to minimize risks and optimize results.
Those are all great points that you each brought up. So it sounds like there are a lot of workable approaches. How do each of you approach skin quality changes in the neck? Not necessarily laxity, but all the rest.
Yeah, this is an important point, and I mentioned some of the small features in the neck earlier, but the neck skin, as I said, is thinner. A lot of the source of healing cells when you do an energy treatment or a peel in the neck, even though it's only a few inches away from the face, those healing cells are 1,000-fold less plentiful in the neck than they are in the face. So we have to approach the neck skin differently. We can do things to the face very safely and predictably that we could never do on the neck without getting into terrible trouble. So it means doing energy-based treatments sequentially to stimulate new collagen addition to the skin, and sometimes that's energy from above with a light-based application or radiofrequency microneedling. Sometimes it's placing energy under the skin to stimulate the skin from underneath with minimally invasive treatments. And sometimes it's putting collagen-stimulating fillers, things like Radiesse and Sculptra, which are being used in a hyperdilute fashion under the skin to stimulate firming and plumping of the skin from underneath at the same time as you're either peeling or applying energy above. So that multimodality approach, but adjusted to be safe and productive with the delicate neck skin.
Yes, I follow the same approach as a very individualized approach for each patient to see where the main concerns, as Dr. Bass mentioned, the neck skin is very thin. I like to use all the treatments that he mentioned. I usually like the heavy lasers, like CO2 laser, more aggressive treatments, but also better results. So that's usually my go-to, and in combination with radiofrequency microneedling. Together with, I usually leave fillers as last resource for my patients, because I think their risk profile is a little bit higher compared to the other treatments. But I still do lasers, and I also do Botox. So I do a lot of what we call Botox neck lift, or even microdosing Botox to help with the lines and a little bit with the muscle as well. That I've seen good results.
Yeah, it's interesting. I agree with you. I do hyperdilute fillers, but it's not my first step. It's probably much lower down on my list. And I don't do a lot of Botox neck lifts, but I love Botox for the vertical banding, where the vertical banding is muscle and not hanging skin. It really can be a home run, and keep things looking much better controlled in the neck, much longer. So everyone approaches a little different. But I wanted to ask you this, Dr. Maia. You said CO2 in the neck, but do you mean a full field ablative treatment or a fractional CO2?
Fractional CO2.
Yeah, that's an important distinction.
Yeah, I usually do a few months after I do a neck lift. I like to go to that skin and treat that skin 6 to 9 months after a neck lift. And I've seen very good results, especially patients that are massive weight loss patients that they don't have good skin to begin with. And it's very difficult to get a good result or long-lasting result in patients that lost a lot of weight. So I've seen good results with that. And morphines, or actually radiofrequency microneedling devices, are wonderful treatment that can help maintain surgical results.
Yeah, I mean, that's a really critical point, and I think there's much better understanding of this in the aesthetic community than there was a few years back. But you said this super important point that, the lift does a major job on resetting the skin position, but it's still your aging skin. It doesn't change the skin biology or the skin surface appearance. And so something is needed to take that now aged skin and make it look younger. And so that second modality focused on making the skin look and act youthful is
and
really
I make it,
important to get a more
I explain
complete
to the patients in a simple way that the neck lift will reshape the neck, it will lift the skin, it will remove the excess skin. So it's about the quantity of the skin, not the quality of the skin. So even though we're addressing that problem, we still have to address the quality of the skin, which comes with all these treatments that Dr. Baz mentioned.
Yeah, that's the buzzword nowadays, that we've always worked on different features of skin that didn't look ideal or youthful, but we're now making much more global assessment and global treatment for skin quality, separate from what we do with laxity and skin redraping.
Lastly, before we wrap up our discussion today, Dr. Bass, what takeaways should our listeners leave with from today's episode?
What I'd like everyone to remember is that small features can really be a telltale of age. You may have chased the major issues, or you may not yet need the big items, but keeping the small details in place will really help you look your best. When you're smoothing facial wrinkles, it's really important not to leave out small areas, because those areas will stick out like a sore thumb. You're already having the treatment, and important to hit all the little corners and edges that show that feature. A wrinkly neck, chest, or hands, or the earlobes are going to be giveaways if the rest of your face looks smooth. They're going to let people know you're not really as young as your face is trying to represent. As I said earlier, features around the eyes really have a big impact. It's a small area, but it's where people look most of the time when they're interacting with you. And Botox and other neuromodulators are still the king of small feature improvements, creating an overall better and more pleasing appearance. There's a reason that most people who start doing Botox never want to stop, because they look like themselves, but they just look so good that they love it.
Dr. Maia, would you like to add any parting words?
Yes, I totally agree with Dr. Baz. I think it's a good discussion and important for patients to know. One thing I want to mention, it's also the small surgeries that can be performed under local anesthesia. A lot of patients are worried about big surgeries and then they're not ready to do a full facelift. But a brow lift can be performed in the office under local anesthesia, downtime about a week. And as Dr. Baz mentioned, the features around the eye is super important. So an eyelid lift, which is the blepharoplasty, it's also a very quick procedure and very satisfying and rewarding for both patients and surgeons to see how quick, changes can be made in such a quick procedure in the office. So I think most important for people they're listening to this conversation, let's keep an open mind, talk to your local plastic surgeon and see what's available to you, and you'll be surprised what can be done with small procedures. And the other thing I like to always say, plastic surgery is not about vanity, it's about quality of life. So there's a lot of bad rap sometimes related to plastic surgery because people only advertise the bad results. Nobody sees the good results because everybody's somewhat hiding that they had plastic surgery procedures done. So I think visit your local plastic surgeon, discuss your options, and you'll be surprised what can be done with small treatments.
Very well said. After this lively discussion, I see that sometimes good things do come in small packages. Thank you, Dr. Bass and Dr. Maia, for your insights into this fascinating topic.
Thank you, Doreen.
And I'd like to thank Dr. Maia for joining us today and sharing her expert perspective. That was tremendous, and I agree 100% with everything you just said. I think that's beautifully expressed. Thank you.
Mm-hmm. Thank you, Dr. Bass.
Thank you for listening to the Park Avenue Plastic Surgery Class podcast. Follow us on Apple Podcasts, write a review, and share the show with your friends. Be sure to join us next time to avoid missing all the great content that's coming your way. If you want to contact us with comments or questions, we'd love to hear from you. Send us an email at podcast@drbass.net or DM us on Instagram @drbassnyc.